There are some differences between tobacco smoke and cannabis smoke. Smoke is generally never good for the lungs. Smoking does offer instant relief from your symptoms, but there's no therapeutic benefit to the endocannabinoid system. In this episode, we're going to deep dive into the debate surrounding cannabis and its effects on lung health with its smoke. Now, the question is cannabis smoking truly a cause for concern, or is the hysteria a bit overblown? We're going to explore a study that aims to separate the myths from facts and uncover what cannabis really does to you on the inside. More to come. Cannabis versus tobacco smoke. What is the difference? That's the real question here. Well, the study that we're going to explore today is out of the United Kingdom, and it was 3 different organizations that kind of combined forces to get this information out. It was the Imperial College London Institute of Clinical Studies, the National Heart and Lung Institute and Respiratory Medicine, and Hammersmith Hospital. And what they were curious about is because there was an increase of cannabis use, and they were interested in understanding the difference between cannabis and tobacco smoke and its on the health of the lungs. What they found was that cannabis shares some harmful components with tobacco, but they operate completely differently inside the body, which is quite interesting. So the differences are kind of nuanced, and I can tell you the results are going to surprise you. So in terms of respiratory symptoms in cannabis smoking versus tobacco smoking. So first, I just want to make this disclaimer here. Don't get the wrong idea. The effects are different, but smoke is generally never good for the lungs. Smoke is carcinogenic, and it can be harmful with chronic use. Chronic cannabis smokers can experience chronic cough, wheezing, and increased phlegm production. Now, tobacco smoke will produce similar bronchitis-like conditions. However, cannabis smoke does not seem to cause the shortness of breath and irreversible airway changes that tobacco does. So that's one of the key nuances between the two there. Now, when you talk about lung function in this process, one of the key measurements they used in this study was FVC. And what that stands for is forced vital capacity, which is the total amount of air a person can forcibly exhale after breathing deeply. All right, and then what they discovered was that cannabis smokers increase their FVC, while tobacco smokers can permanently damage their FVC. It's quite interesting. When cannabis smokers quit smoking, the lung health was not found to be negatively impacted in the long term, including no signs of COPD. And they didn't quite fully understand why the differences there are between the two. One thought was that it possibly because cannabis can relax people so much that it can relax the lungs enough where it's not causing that irreversible damage. But that they did admit in the study, more studies need to be done to understand this fully. Now, then the other talk is about cancer. Does this affect someone's ability to get cancer? The answer is kind of nuanced there. So the researchers in this study did say that more studies need to be done to completely conclude whether or not cannabis smoke does lead to cancer-causing conditions. But what they did found is no link. There was no link between cancer and smoking cannabis, like there is between tobacco smoke and cancer. Now, what they did find, though, with chronic cannabis users, a rare occurrence of bullous lung disease amongst those users. This is a condition that occurs when air pockets form in the lungs, and it can be quite painful. It can make it quite difficult for the lungs to exchange oxygen and carbon dioxide. It leads to shortness of breath, and it can even lead to hypoxia. So this is something to be careful about if you are a chronic cannabis smoker. And so and to kind of wrap it up here, so although the answer is quite a bit more complex than you may have imagined, there are some differences between tobacco smoke and cannabis smoke. Now, here at My Florida Green, we want all of our patients to be responsible users and just be aware of these types of things, and that's why we talk about these on our podcast. And I definitely recommend exploring other routes as well, because one thing I want everyone to remember, smoking does offer instant relief from your symptoms, but there's no therapeutic benefit to the endocannabinoid system. And for those of you who don't know, the endocannabinoid system is a series of receptors that run all throughout the body, and they help to regulate our central functions. You can help engage that endocannabinoid system by ingesting cannabis and metabolizing through the liver because there's an enzyme there that helps break it down and helps it interface with your endocannabinoid system. While smoking just goes to the capillaries of the lungs, the effects go to the CB1 receptors in the brain and helps with your symptoms, but doesn't help to heal and prevent from the inside. So it's the key difference between, edible routes or sublingual routes and smoking. So I want everyone to really understand that. But, not to negate the effect of cannabis smoke, because it can give you instant relief, especially if you're in a really tough spot. If you have a lot of pain, if you need to get to sleep quickly, or you're just very anxious and you want to calm down quickly, it can be a great route for that. But just understanding combination of other routes could really help to balance you in the long term. Here at My Florida Green, we want to build our community of people together because we learn more together. So we want your input. And I want to ask this question to you, to everyone out there. I want to hear your thoughts in the comments. So please comment, tell us what you think. But I want to hear from you. Is cannabis smoke indeed a cause for concern for you, or is this hysteria overblown? Can't wait to hear your thoughts. Till next time.